I'm Dr. Paul Charleston. I have clinics in London, Yorkshire. I'm going to talk to you today about thread lifts. There's a lot written about thread lifts, said about thread lifts in social media, how terrible they are, how great they are, etc., etc. I think the answer's somewhere in between. Now, thread lifts aren't surgery, but they don't carry the downtime of surgery, the cost of surgery, and the risks of surgery. So they're just part of an armament of anti-aging techniques, and what they usually are threads which are usually made of something called PDO, which have barbs on them. They're placed into the skin, to the fat layer, and they hitch the skin and fat up. But what they really do is, when they dissolve, they create collagen, and that creates a more youthful skin tightening. And this is where they're very valuable. So thread lifts are quite a useful part of the anti-aging armament. People say that they're risky. Well, again, like any procedure, they have risks. Most of the problems you see with thread lifts are around swelling and bruising, and these go away within a few weeks. Sometimes you get a little bit of puckering, that again goes quite quickly. The major risks, infection, really can be avoided if you use sterile technique. And rarely you can get things like transient nerve damage and some nodules and protrusion of the threads. But again, actually, in surveys, these are really quite rare and often confined to practitioners who are perhaps less experienced and perhaps don't have medical training. So thread lifts really are part of an ornament, and I don't think they should be completely discounted. I think it's about making patients have realistic expectations as to what they're getting. And if you choose the right patients, people really like thread lifts, and some patients come back for further thread lifts, which suggests to me that they do like the results. I hope that's helpful. If you want to discuss them further, please do get in touch. Thank you very much indeed.